I'm Curtis, and I'm on the Patient Advisory Council for the Chronic Disease Coalition. I also serve as an ambassador and advocate for the CDC, and I'm a 9-year kidney transplant recipient, having received a kidney from a living donor. I'm here to welcome you to the Chronic University, our training series designed to help chronic disease patients and their supporters become more effective advocates.
Hi, I'm Claire Sachs, and I sit on the Patient Advisory Council for the Chronic Disease Coalition. January is coming up fast, and the state legislative sessions will start then. Some of them are actually fairly short, and the Chronic Disease Coalition is gearing up to advocate on behalf of patients on several legislative issues, most of which fall under 3 categories: access, affordability, and representation.
Hi, I'm Mary Kay Clunies-Ross, and I'm the Executive Director for the Chronic Disease Coalition. Throughout this whole series this year, we've walked you through the steps of advocacy so that you can learn to tell your story to patient groups and to legislators. And this is where it all comes together. Chronic University 4 is all about the legislative agenda that we have, which is where we connect your story and your experiences to all the different potential laws and policy changes that we can affect in our own states and even in the nation. What we're working on is to help legislators understand, through your stories, how they can change law and policy to make a healthcare system that is more centered on patients and on the real lives of people in communities across the country. Our policy agenda falls into 3 general categories: access to care, affordable treatment, and representation. That means being able to get into your provider in a timely manner. It means getting access to the treatments that they provide, whether they're devices or therapies like physical or occupational therapy, or whether they're medicinal treatments that need prescriptions. This includes fighting for fair step therapy practices, protecting living donors, promoting telehealth accessibility. It also means protecting your right to access specialists for care and other less obvious issues like expanding transportation options and expanding the healthcare workforce.
I've had people who have talked to me where they have struggled to get access to a specialist or treatment because there's a lack of specialists in their area, especially those who live in rural areas.
I lived in the 2nd largest city in Indiana, and there were no pediatric endocrinologists. And the reason that is so dangerous is because there are very particular issues that are focused around young people and teens and diabetes, and that adult endocrinologists may or may not have experience with.
Improving access to care helps everybody who's having to deal with a chronic disease.
Being able to have access to both the people and the treatment mechanism that you need is absolutely necessary for patients to be able to live their best lives, but also for patients to have lower cost, because the more developed a disease gets, the more expensive it is, both for the insurance company and for the patient.
Second, we're focused on affordability. Nobody should have to make choices between rent and food and childcare expenses and their medication and treatment.
Some of the affordability challenges that are faced by people in accessing treatment comes in the form of being able to afford medication, especially those specialty meds that cost enormous amounts of money.
We want to make sure that cost savings make it to the patient level. That's why we work on some of the hidden cost drivers in healthcare, like pharmacy benefit managers, alternative funding programs, and prescription drug affordability boards.
Really, the most challenging affordability piece I've ever had are the years when I needed to see my psychologist. I ended up spending upwards of 15% of my pre-tax income on healthcare.
I know for myself, I pay hundreds of dollars for my immunosuppressant drugs every month. But unfortunately, there are people who cannot afford that and have to make certain decisions. And we've seen it in the kidney community where people have received the kidney but are unable to afford the immunosuppressant drugs and have lost the kidney and have had to go back on dialysis.
When I was choosing a career path, I was limited by the fact that I knew I was going to need to work for a company that was large enough to be able to absorb the cost of all my diseases.
Our third area of work is in the area of representation in healthcare policy and in healthcare outcomes. There's an old saying in politics that if you're not at the table, you're on the table. And that means that if you're not part of the process, it's your interests and needs that are getting carved up and given to other people. That's why it's so important to us to have the patient voice at every table. There are a few ways of looking at representation. Two really easy but important ways that state governments can keep patients at the center of their work is rare disease advisory councils and chronic kidney disease task forces.
I think what the general public and legislators do not understand about kidney disease is that it's a silent killer. Better education for the general public and better education, especially for our legislators, would be really good to understand what the kidney function is and how it affects a person's body when they have chronic kidney disease.
Representation isn't just about task forces and standing governmental bodies. It's also about making sure that all parts of our community are considered as we do healthcare policy. That means looking at outcomes and seeing how different groups are having different experiences in our healthcare system and how we can even out that so that everybody in this country has access to affordable, quality healthcare.
It is important to have the presence of the patient and the voice of the patient represented in policy discussions. The patient, we live through this disease 24/7. We live through the pain, we live through the depression, we live through the hopelessness of what's going on.
I think there's hope because our community, as patients generally, are starting to realize that they can have an impact and that it can be a serious impact, and that in the right setting, with the right support, they can start to steer things in a direction that is going to be beneficial.
We're not just patients. We are still people. We still have a brain. We can still think. We can still give our opinions. So include us as part of your representation. Include us as part of the clinical trials. Include us as part of the patient advisory boards. Let our voices be heard because we have a lot to say.
I really appreciate what Curtis and Claire bring to this conversation. We want to make sure that voices like theirs and like yours get heard from legislators all across the country. And that's why part of our goal is to represent you when we talk to legislators and to other partners. The other goal is to help you speak for yourself and make that easier so that you can be a powerful voice in your own community. You're the one who works and lives with the legislature. You all share communities. It's really important that we develop those relationships, and that can start really, really small. It can be just signing on to a letter. It can be just dropping by a postcard. It can be saying hello at a meeting. But building that relationship is going to help you be a better advocate. As we move into 2025, patient-centered advocacy is more important than ever. We need to have these conversations, and we need to do it person to person, patient to legislator. We want to make it possible and easy for you to advocate for yourself. It's not just about us as an organization, it's about making room for all the patients who are struggling with healthcare law and policy to have their voice. And the more you use your voice, the more you also help others. We have room for everybody at the table, so we would love to see you join us.